Hello friends and welcome back to my channel. In this video we are going to talk about intracranial hemorrhages, under which it will come subarachnoid hemorrhage, the epidural hematoma, the subdural hematoma. We'll talk about it. We'll include the mnemonics altogether, the myasthenia gravis, the GERD, Hirschsprung disease, the newborn resuscitation questions, the Apgar score. I'll explain you the Apgar score very well, and we will see the chlamydia infection. So let's start. Intracranial hemorrhages. So what are the intracranial hemorrhages? So bleeding within the skull, often due to ruptured blood vessels, can occur in different areas of brain. So what are the symptoms which we are going to see in the patient? Sir, they are the sudden severe headache. So this is hallmark finding itself for subarachnoid hemorrhage. When the subarachnoid hemorrhage is there, then the patient will be complaining about the severe headache. You will see in the question that the headache is so severe that the patient with subarachnoid hemorrhage wants to run somewhere. This question will say the patient is agitated and wants to run somewhere. This much severe headache is in the cases of subarachnoid hemorrhage. Other, since it is a neuro problem, so loss of consciousness, nausea, vomiting, seizures, paralysis in one side of the body. This is more related to the ischemic stroke finding. Speech difficulties, visual disturbance, eye muscle is small, so visual disturbance, neck stiffness in subarachnoid hemorrhage. Remember guys, in the meningococemia also we saw the neck stiffness, because that was also the problem with the neuro symptom. Here is also the problem is with the neuro system. So in neck stiffness is or the positive kerning sign, those signs of meningeal syndrome are positive in the subarachnoid hemorrhage cases as well. So before I forget to tell you, subarachnoid hemorrhage, the treatment for subarachnoid hemorrhage is EACA, epsilon aminocarbonic acid. So this is Croc's treatment. This is not the real treatment. For me, this EACA is just a relaxant for the patient, which may solve the headache maybe. It's not the first line treatment. The first line treatment is nimodipine. Some 60 mg we can start with the infusion of nimodipine. So that's the first line treatment for the subarachnoid hemorrhage. However, remember about the Croc's treatment. Nimodipine you will not be even in the option. This is far away from logic here. Croc's treatment, remember about it, that for the subarachnoid hemorrhage, the treatment in Croc question will be EACA, epsilon aminocarbonic acid. So let's move next. Let's see some patients over subarachnoid hemorrhage. So a full-term newborn suffered intracranial hypoxia, Apgar score 2 to 5 point. I'll explain you the Apgar score in some minutes. After birth, the baby's excitement is, however, Apgar score 2 to 5 is a bit lower as per me. I mean, this is not really a good score. Baby's excitement is progressing, occurs vomiting, nystagmus, pains, squint, spontaneous Babinski or Moro reflex location of the intracranial hemorrhage. So the question is asking about where the intracranial hemorrhage is located. So remember, when the Babinski is positive, Moro is positive, and the poor Apgar score is there, intracranial hypoxia the patient had heard. The newborn has suffered the intracranial hypoxia. So remember a little bit different diagnostic criteria in the cases of newborns. So remember about this reflexes. However, I'll throw a reel on YouTube showing how the reflexes are working in the patient. So subarachnoid hemorrhage. Let's hear from the next neonate. Next is also the case of newborn infant. Delivery was performed with the obstetrical forceps. So if the delivery was performed with the obstetrical forceps, so we already suspect some chances of the birth trauma or birth injuries are already there. Apgar score is poor here as well. 1 upon 3 is really poor. Face is bluish pale, head is thrown back, severe birth trauma is present. The question is screaming about the cerebral scream. So cerebral scream, this much poor neurological status, sir, in which is seen? It is seen in subarachnoid hemorrhage. However, let me tell you the hallmark finding for croc questions. This is the liquor. What is liquor? Liquor is a CSF, they mean to say by the cerebrospinal fluid. So liquor contain erythrocytes. Sir, this is red colored liquor. Red colored CSF means subarachnoid hemorrhage for sure. So this is the hallmark finding for the subarachnoid hemorrhage. That also other symptoms are there. Hyperparesthesia. Hyperparesthesia, yeah. So increased muscle tone in one part and sensitive to the stimuli is increased in one part of the body. So this is the case of subarachnoid hemorrhage in the newborn. So let's see next case. Next patient said acute headache accompanied by the nausea and vomiting, impaired consciousness, BP is severely high. I'm reading the question number 4. Face is hyperemic, consciousness is clouded. Sir, headache, we know that headache is something hallmark finding in a lot of pathologies actually, but here the bloody CSF is given to you, which is hallmark for the subarachnoid hemorrhage. However, meningeal signs are positive here, so please do not mark meningitis in this case. In meningeal cases, the CSF is yellow because that's a bacterial infection, and you will see the neutrophilic pleocytosis in the CSF. So neutrophils will be elevated because that's a bacterial infection. Here the meningeal signs are positive because problem is with the neural system. So sir, CSF is bloody, so mark the subarachnoid hemorrhage. Next patient is a man with the cerebral artery aneurysm suddenly developed severe headache. We got our headache, yeah. We got the stiff neck is also a hallmark finding for subarachnoid hemorrhage. We got the positive kerning signs. Sir, what is kerning sign? We don't understand it. Sir, when you elevate the neck of the patient, the legs will also raise by itself. So you just have to keep the patient lie on his back, and when you will elevate the neck of the patient, the legs will also raise automatically because problem with the neural system here. So sir, mark the subarachnoid hemorrhage. Next question also says that the lumbar puncture was performed and because they suspected the intracranial birth injury. So what problem? Bloody CSF was obtained. Sir, bloody CSF is in the cases of subarachnoid hemorrhage. Ischemic stroke, I have explained in the portions of ischemic stroke. However, you can read the question again. Watch my video over the portion stroke. Let's go next. Next again the patient says one more thing I wanted to show you. In the question number 5, it says the patient is agitated and wants to run somewhere because the patient is having very severe headache. Sir, let's go. Okay, let me explain this to you. I will not. Okay. In the morning, upon waking up, 65-year-old patient developed weakness, sudden weakness in the right side of the limb, speech disorder, decreased sensitivity to the left side of the body. Consciousness, BP is low. Remember, in the cases of subarachnoid hemorrhage, the BP will be high, but in the cases of ischemic stroke, the BP will be low because there is not enough supply to the body or the brain because of some clot got stuck in the one side of the brain. So motor aphasia, which is speech difficulty, right-sided central hemiparesis. Sir, what is hemiparesis? Sir, hemiparesis is the weakness of one side of the body. hypalgesia. So this is reduced sensitivity to the pain on one side of the body. If the clot got stuck in one portion of the hemisphere of the brain, so that portion will not get the blood supply. That portion will not let the impulse get transmitted to the rest of the body. Yeah, so in the cerebral hemisphere, in the if the clot got stuck, so you will see problem with the one side of the body. If the clot gets stuck in the both sides, you will see the problems with the both sides of the body. So yeah, ischemic stroke. So I hope you will remember it. Please watch the video as well for better understanding. Let's see, next patient has also the sudden pacing headache and who fall down unconscious, agitated, meningeal syndrome, lumbar puncture yielded the bloody CSF. Sir, CSF will be yellow in the cases of meningitis. Sir, CSF will be the bloody in the cases of subarachnoid hemorrhage. Next is epidural hematoma. So epidural hematoma is the collection of blood between the skull and the dura mater. Sir, I have made a mnemonic for you, E, epidural hematoma. So the CT findings, if you want to see in the cases of epidural hematoma, it will be eye finding, eye lens shaped. It will look on the CT scan. Eye shaped finding, the biconcave or convexo concave, this is something like that, but remember the lens shaped shape. Emergency conditions, the patient is will be in the severe condition. It is an emergency condition. Sir, it is caused by the external trauma. So the question will scream about some trauma for sure. Let's hear it from our patient. So the closed cerebrocranial injury, we see that external trauma. Fracture of the right temporal bone. 5 hours later, the patient condition sharply deteriorated, developed the respiratory disorder, developed the tonic-clonic seizures, developed the anisocoria, dilation of the right pupil, it means. So what complication arise in the patient? Sir, he had a external trauma and this is an emergency condition. We can see the seizures in the patient. This is an emergency condition. Sir, this is the case of epidural hematoma. Next is subdural hematoma. Another mnemonic for you, SSSS, subdural hematoma. In the subdural hematoma, the blood will be collected in between the dura mater and the arachnoid mater. Sir, this is why between this? So some vessel would have got ruptured, my dear. So in the question, maybe they highlight something or not. Maybe sometimes they highlight it with the blood pressure. If the blood pressure is too much elevated in the cases of subdural hematoma, you have to suspect. Because there is a very severe range in the intracranial pressure in these cases when the blood collection is between the dura and the arachnoid mater. So suspect some vessel would have got ruptured inside over there. So second S means sudden severe headache. Sir, this is also seen in the cases of subarachnoid hemorrhage. So remember that it is seen in the cases of subdural hematoma as well. Sir, who will be affected with this subdural hematoma mostly? Sir, sick old people will be affected with this. Sir, how the CT will look? So the last S or C are similar. So I hope you will remember the crescent shaped hyperdensity will be seen in the cases of subdural hematoma over CT scan. Let's see the patient's profile. So patient is 54. He is old case. Patient is 54-year-old, sudden severe headache. Sir, we got our sudden severe headache. So in the back of his head, vomiting, hypertension. Sir, why sudden severe headache? Sir, because the intracranial pressure would have raised too much. So in the history says hypertension, takes hypothiazide for the solution of hypertension. Intense headache revealed by analgesic. Objectively, the consciousness is clouded. The left pupil is dilated. So, left pupil, we saw the pupil dilated in the clinical death as well. So, remember about it. Photophobia, tense neck muscles. So this is something neurological problem. So again the stiffness we see in the question. So in all the neuro problem, most probably you are going to see this stiff neck or tense muscle of the neck. Left sided hemiparesis. Sir, this is increased muscle tone plus reflex in one side of the body. Temperature is low. BP is 230. Remember that we discussed about pheochromocytoma, that BP is high in the cases of pheochromocytoma as well, like this, like 230, 240, 260, 280, like this severity of BP we see in the cases of pheochromocytoma as well. So sir, why the BP is raised? Sir, because some vessel got ruptured, right? In the cases of subdural hematoma, some internal vessel got ruptured. I have wrote it here for you, which will make the blood pressure increase. Sir, this is the case of acute subdural hematoma. Let's go next. Next is Myasthenia Gravis. A short comment over Myasthenia Gravis, because only one question is there. Sir, what is this? This is an autoimmune neuromuscular disorder characterized by the weakness and rapid fatigue of the voluntary muscle. So it occurs when the immune system produces antibodies that blocks or destroy the acetylcholine receptors, all right, and neuromuscular junction, preventing a proper communication between the nerve and the muscles. So the problem with the ACHRS, acetylcholine receptors, will get destroy or block. So due to this, we are going to see what problem in the patient. We are going to see muscle weakness in the patient. We are going, eye muscle is small, sir, very small, very eye muscle is this much small that even if the mild problem is there with the CNS or any sympathetic system, the ptosis, diplopia, we are going to see in the question. Sir, what are they? Sir, the patient cannot open his eye properly even if he try a lot. Sir, next, limb weakness, respiratory muscle weakness, all the muscle weakness we are going to see in such questions. Main finding, the hallmark finding which we are going to use in the croc question is the eye muscle, the drooping of the eyelid, like the patient is trying to elevate or open his eye, so it will not be opening. Let's see the patient, let's hear from him that he complains about the double vision. 46-year-old patient complains about the double vision, drooping of the eyelid that occurs mainly in the second half of the day, almost completely disappear after a rest. So slight bilateral ptosis, reduced lateral movement of the eyeball, diplopia, positive proserine test. So you see in this question that all the eye findings are there. So even if the problem is a little bit with this myasthenia, so the eye portion or the optic findings will be highlighted as very well. Sir, so proserine positive in the cases of myasthenia. Sir, what is this proserine test? So proserine test or neostigmine test, so what we do is we try to inject proserine or neostigmine in the patient, and if the eye movement or the drooping eyelid problem of the patient got improved, it means the proserine test is positive, which is seen in the cases of myasthenia gravis. So after this proserine or neostigmine is something which will enhance the activity of the sympathetic system. So hence followed by the eye movement improvement. So I hope you understand it, and let's go next. Next is GERD. Sir, what is GERD? So gastroesophageal reflux disease. So chronic condition in which the stomach acid flow back to esophagus, maybe due to vasodilation, or maybe due to overeating, or maybe due to a lot of cases. So symptoms we are going to see in the patient: heartburn, regurgitation, dyspnea, chronic cough, sore throat, hoarseness of voice, asthma like symptoms. Not a lot like this, but let's see, the hallmark finding will be the heartburn. So heartburn will be seen in the patient very severely in the cases of acid reflux. So let's hear it from patient. Burning retrosternal pain usually occurs 1 to 1.5 hour after eating, because the acid is releasing after the patient is eating, so become worse in the horizontal position. If the patient tries to lie on the bed, the acid start to flow in the esophagus, right? So it will cause the burning sensation, or we call it heartburn in the medical terms. uh, so uh, Esophagogastroduodenoscopy findings detects two lesion foci in the lower third of the esophageal mucosa. Sir, what are these findings? Sir, these are the findings caused by the acid reflux. That acid got reflected to the esophagus and caused these problems with the lower third of the esophageal mucosa. It damaged it. So foci are up to 5 mm in size and located within one fold. Tactics in this optimal case. Uh, so so you see, the case is related to the acid reflux. Yeah, when the patient is going to the horizontal position, he is facing problem of the acid reflux. So the question asked over it is, what is the treatment tactics? Sir, we are going to prescribe the proton pump inhibitors to the patient. Sir, what they will do? Sir, they will reduce the HCl secretion in the patient. Even if the patient eats too much, the HCl secretion is going to be get reduced. Proton pump, if the HCl is reduced, the patient will feel a bit relief. If the HCl secretion is low, then the acid reflux would be low. Yeah, makes sense. Proton pump inhibitor, so these are the group of drugs which will be lowering the secretion of the HCl. For example, omeprazole is also given in the cases of peptic ulcer. Omeprazole is something which you have to take empty stomach in the morning, so that before you have a breakfast, the omeprazole will already block your acid secreting receptors, and after you will eat food, so very low or minute or only the required amount of acid will get released. The too much acids will not get released. I had this problem. The heartburn is really severe. I had it like 2-3 weeks ago. So the heartburn is very severe in this case, I cannot tell you. I'm living in Poland. So instead of omeprazole, if you are also living in Poland, the choice of treatment will be proprazole. The same suffix, omeprazole or proprazole, has to be taken first thing in the morning, empty stomach, and before having breakfast, 30 minutes before or 1 hour. So I hope this is clear now. Next is Hirschsprung disease. Hirschsprung disease is the also known as congenital aganglionic megacolon. Sir, why aganglionic? Sir, because there are no ganglions in some portion of the gut. So a condition that affects the large intestine colons, which causes problem with the passing stool, characterized by the absence of ganglionic cells or nerve cells in a segment of bowel, leading to the lack of peristalsis and bowel obstruction. So what are the symptoms? Symptoms is failure to pass meconium within the first hour of the birth. So why this is there? So because in one portion of the gut, the ganglion cells are not there, so there will be no peristalsis. So we are going to see the toxic megacolon in such cases. So the baby will not be able to pass the meconium because he is having that problem with one segment of the gut. Yeah, Abdominal distension, because the everything whichever he is eating or drinking is not passing through the all the systems. It's just getting stuck. Yeah. Vomiting, bile stains. Sir, why bile stained? Sir, because the problem is in the intestine, so the food will not be able to move after the duodenum. So when the patient is vomiting, it will be a bile stained. So constipation, you know about it. Growth failure, because malnutrition is there. Yeah. The patient is not having a good GI movement or good GI tract right here in the Hirschsprung disease. So there will be problem with the growth, or let's say malabsorption. Other children will see chronic constipation, abdominal pain and distension, fecal impactation. Diarrhea can occur due to overflow incontinence. Okay, let's see the patient. So it's a 3-year-old boy, stool retention since birth. Having 3-4 days, every 3-4 days the mother gives him enemas. The boy lags behind his peer in physical development. Sir, why the mother is giving him enema? So this is for increasing the GI motility. So enema will when the enema is given when there is a stool retention in the patient, so it will increase the GI movement and the stools will be able to pass easily. So why physical development retardation? Sir, the patient is not having a good condition of the gut right here, so the physical development, the patient is lagging right here. The case of malabsorption, which you will also see in the questions of pancreatitis. So pale skin and distended abdomen. You got the findings, guys. So a disease suspected is Hirschsprung disease. So because of in one segment of the intestine or gut, the ganglions are not there, so there will be collection, or the toxic megacolon case will be there. So distended abdomen, because everything is not passing well through the or draining well through the GI tract. So I hope this is clear. Newborn resuscitation, the CPR of the newborn, how to manage it. So let's hear to the case directly. I hope you know how to do the newborn resuscitation. First patient states that after the pregnant woman water broke, it was noticed that there are significantly contaminated there with the meconium. Upon both, the baby is not breathing, remains inert, skin is cyanotic, covered with meconium. Heart rate is 98. So newborn heart rate should be 110 to 160 or 1920, a bit different. Yeah. So 98 is fetal distress here. Or let's say the newborn distress here. So the question already highlights you that the resuscitation measures should be taken. So what resuscitation measures you will take? Sir, do the emergency procedure, because we want to be sure with our treatment. So what you are going to do? So we are going to insert a laryngeal tube in the patient for the better breathing. We will do intubation. We will check if something got stuck over there, and a sanitation of the trachea, because the baby has aspirated meconium. So what we will do? Laryngoscopy, intubation, and sanitation of the trachea. We will clean the tracheal tract so that the meconium could be cleared, and as soon as the tract will be cleared, the baby will start to breathe normally. His conditions will improve. So remember for the question, guys, direct laryngoscopy, intubation, and sanitation of the trachea. Next is Apgar score. Okay, let's hear what is Apgar score. Sir, Apgar score is a score which is used to see the newborn's condition, if the newborn's condition are good or not good. So let's hear it. The points which we are going to cover under this is appearance, heart rate, the reflexes, the muscle tone, and the respiration. So appearance, heart rate, grimacy they say as the part of mnemonic, activity or muscle tone, or respiration. So let's hear it one by one. You will remember it easily, no need to worry about it. So appearance, if blue or pale, 0 point will be given. if the appearance is a bit pinkish type, which is better than blue, so 1 point will be given. If the baby is completely pink, which is probably totally normal, newborn babies are pink. Remember, pink is better than pale. Pale is a case of jaundice. So pink is better than pale, so pink baby will be totally normal, give the points 2. And heart rate if absent 0, if heart rate less than 100, remember that heart rate in newborn is 110 to 150 or 160 around somewhere. So if heart rate is less than 100, so we will give only 1 point, because heart is beating, right? Absent is not there. If heart is beating, we will give 1 point. If the heart rate is more than 100 beats per minute, we will give good points, we will give 2 points. Let's see the Grimm's reflexes. So no reflexes, 0.0, a little bit reflexes, a 0.1. And if the baby is coughing or sneezing, that's the best response ever, because the baby will cough in the first time of the life, cough or cry or sneeze. That will be the best condition of the newborn. Activity, muscle tone. So limp means no activity, 0 points. Some little bit activity, 1 point. Active movements, the baby is crying well, the baby is trying to catch the beard of the doctor, the baby is catching your stethoscope, the baby is crying and active, very active, so give 2 points. Respiration, absent will be 0, a little bit weak cry, like a kind of the baby is crying, but in what sense, like that. So the baby will be having weak cry, 1 point. If the baby is crying very nicely, if the baby has taken the whole hospital on his head by crying very loudly, so give 2 points, because crying is something, the best thing which is noticed in a newborn, that the newborn is normal. When the baby will cry, his lungs will expand and will be able to catch more and more oxygen, and hence the more expansion of the lungs. Now we can see the question. So sir, there is a girl, full term in girl with the fetoplacental insufficiency, was born from the second pregnancy, that is termination at 25 to 27 weeks. During the childbirth, the umbilical cord was revealed to wrap around once around and the neck of the baby. Extraction of the shoulders was difficult after the birth. So now it's the important part. So after the birth, what happens is, the baby is not breathing, 0 points. The baby's heart rate is less than 100, 1 point. Total cyanosis, sir, cyanosis is not a good sign. If the baby is looking blue, this is so bad that the baby is not having enough oxygen supply. If the baby would be breathing enough, so he should be pink or pinkish type. So cyanosis is not a good sign, give 0 points. Atony, sir, this is about the muscle tone. Sir, there is no muscle tone. Atony means no muscle tone is there, sir, 0 point for this. Areflexia, sir, the baby is not showing any reflex, sir, 0 reflex, sir, 0 point for it. So now the total Apgar score of the newborn will be only 1 point. So the answer is 1 point. I hope you understood it very well now. Here also I have written it because there is only one question in croc. If you do not remember the table, I hope you will remember at least this, that heart rate less than 100 will be given only 1 point, and heart rate more than 100 will be given 2 points. However, you can remember that in this case the Apgar score, the answer was 1. So I hope this is clear now. Next is chlamydia. Chlamydia, we have talked in the reactive arthritis portion that chlamydia is transmitted through the STDs. It's an infection caused by bacterium Chlamydia trichomonasis. Primarily, if it affects the genital tract, and can also affect the rectum plus throat. Sir, in the syphilis as well, the rash is on the mouth, rectum, mouth and the rectum and the genitals. So no need to mug up with chlamydia. So this is not the syphilitic case. The patient will be asymptomatic, silent, as they say. If there are some symptoms highlighted, so how to look at the patient? Sir, abnormal vaginal discharge even in the main discharge from the penis. So burning sensation, in the males also burning sensation during urination, pain during sexual intercourse, bleeding between the periods after sex, lower abdominal or pelvic pain, pain in the male, pain and swelling in one or both the testicles. So only one question was asked in the croc exam, that a person is directly diagnosed with the chlamydial infection. Therapy, sir, prescribed the macrolide antibiotics. The chlamydia will die shortly. So I hope you will remember about it. This is the mnemonic CM, if you can remember. So I hope you will remember it. This is it with this video. I hope you are enjoying the videos, and if there is something, let me know in the comments. Let me know your mistakes in the comments. So this is it, and see you in the next video.